Hi, this is Hallie Barney. I decided to do my career profile on becoming a marriage and family therapist. My career contact was Dr. Ryan Christensen. He is a clinical social worker and therapist. He's located in St. George, Utah. So his working environment, or the working environment in he owns his own practice, and so he gets to control who he works with and when his scheduled hours. So he works Monday through Thursday, and he works from 8 to 8, and then on Friday he works from 8 to 10. So about over 40 hours a week on average, sometimes more, sometimes less. He has a lot of flexibility because it's his own practice. So he can choose to take those vacations or do what he needs to do as long as he schedules his patients around that and he lets any know if he does need to be gone. He is specifically works with trauma victims. He works with trauma, sex addiction, and PTSD and other traumatic experiences as well. He works specifically with adults and teenagers. And when I asked him why he didn't work with children, he said he didn't feel it was in his skill set that he to be able to work with kids, to be able to help them, but also to be able to almost babysit them. Because when you're working with them, sometimes you'll need to help them behave, and so it was just easier. He said he works better with people, with adults and teenagers. His typical stressors. So, because he works specifically with trauma victims, the experiences that these people share are very heavy and emotional experiences. And when I asked him how he deals with these, he said, due to HIPAA laws, he can't say much even to his wife, but occasionally he will talk about the breakthroughs that he had or specific hard or especially hard cases or clients without naming names. And that can help sometimes. Also, he says it's very important to practice good self-care. So if things get extra heavy and extra emotional, he will take time to let a good cry. If it gets stressful, he will give himself a timeout, if you will, and take time to calm down and kind of check out for a minute. And then if he gets really tired, then he'll give himself an extra long lunch break so that he can take a nap and then continue to help people and be at his best to help people through these experiences. Another hard thing that he runs into is most of the people that come to him are willing. They want to know how to cure or how to fix their problems. They want to know how to become better and not fear the things in life that aren't supposed to have fear attached to them. And so most of them are willing, and they listen to what needs to be done and they do their part in the healing process. But some people will refuse it. So he'll give them what they need to know, and then they don't want to change, so they don't make the effort, and they don't go through the process that can be really heart-wrenching and hard, but is needed in order to heal. And so it's really hard for him to see these people who could be so much more and who could have so much more peace in their life if only they did their part, but they don't. Typical benefits. So he receives excellent health benefits, including paid vacations. He also gets life insurance and medical insurance. He also has good job security, and he's able to move with this job as well. So yes, he does have his practice, so it wouldn't require him shifting his practice over to a different state, wherever he would want to go. But if he does move states, that also means that he needs to make sure that he is fulfilling the requirements needed to be certified in that state, because there are different requirements for different states. The common job tasks. So he talks with all kinds of people, and so he needs to be able to talk with people and be comfortable with that. He schedules new and current patients, as well as patients. He schedules them. And then he writes notes, and this is about appointments and progress of the patient. So he will write their name, and then he'll write things, their struggles, and sometimes this can be good for just refresher. Okay, who am I seeing today? And what are the things we're working on? And what is their progress? Are they progressing? Are they not progressing? What do we need to hopefully get done today? Goals of things in the next session. So usually they take notes after, or sometimes in the session. Educational requirements. So he received his master's degree, or first his bachelor's degree in psychology, and then his master's degree in social work, both from the University of Utah. And then he specializes in EMDR, which is a specific trauma treatment. And in order to have or to be certified in this certain treatment, he needed to go to a institute in order to do that. So he went to the International Institute of Trauma and Addiction Professionals, and then he learned what he needed to know for this, and then he was certified. So if you want to specialize in anything, then you have to go through the process of learning and educating yourself, and then also becoming certified, so that you're not teaching or practicing outside of your skill set, which is against ethics, is if you're teaching outside. So it's important to have that certified if you would like to teach those things. Also, each state has requires you to have a license to counsel. That's another requirement. So starting salary, when you are first starting out, you can make around $17 to $18 an hour, which is about $40,000 a year. And of course, as experience increases and as you gain more education, more money comes with that. So if you are more experienced, you can receive around $100 a session or $100 an hour. And some charge more, some charge less than that. And I don't know how much Dr. Ryan Christensen makes, but I know that he is more experienced than most, and so he makes more than $40,000. You can make around $70,000 a year on average for more experienced professionals. And then miscellaneous career information. So there are many important qualities to be a counselor, and some of the most important ones are first to have good interpersonal relations or skills. And so you need to be able to talk to people. You need to be able to be comfortable with that, because that's your entire profession. You're talking with people, you're helping them. And so being able to be patient and respectful to your clients and helpful, that's part of that. Another one is being an excellent listener. So it's very important that you not sit and just counsel, but also sit and listen. And this allows the patient to, one, talk about it, so they're reaching down to these struggles and surfacing those, and then also to give advice in return to that listening. You also need clear communication. So with this, and when you're giving this advice, it's important that you know what your education is, and you're updating your education. You're able to communicate clearly what can be done, suggestions they need, and counsel that they need to make their relationships better. Another thing that you need to be is a good note taker. So like I said earlier, one of his common job tasks is note taking. And this is for the patient as well as yourself, so that you know who you're working with, what their struggles are, and how they're doing, and how they're progressing. And then in turn you can look at other educational resources that may help you with certain clients. So if you have those notes, you'll know this person's this far along, and it's very helpful. It's also required. Another thing that's awesome is that this career is a super rewarding profession. It is heavy, it's emotional, but it's very rewarding to be able to help people become their best selves and to help them understand things they don't, and understand what their fear is attached to, and help them take that stress from situations and allow them to have more peace in their life. And he said it is the coolest thing, in Dr. Christensen's words, he said, is the coolest, awesomest thing to see people become their best selves, to completely transform their life and live life in happiness rather than in fear of things they don't understand why they're in fear for they're scared of. And so thank you for listening.